Let's begin tonight with the latest on the Omicron figures. In India's Omicron COVID count has gone up to 135. That number going up quite steadily over there. 6 more patients have been found to be infected of Omicron in Maharashtra. Earlier today, 4 fresh cases coming in from Kerala as well, and it was all at the moment being detected in 11 states. We are flagging all those figures over there for you. The centre has warned it is likely that the spread of the new variant will outpace Delta when there is community transmission, and it has advised people to avoid all non-essential travel and mass gatherings and keep New Year celebration low intensity as well. But as we bring you all those numbers, let's also look at some of the metros. Let's begin with Delhi over there, where what exactly is happening is that 100 cases have come up in the past 24 hours. 1 death also being reported, the first in 10 days. The highest daily spike has been seen in nearly 6 months. And active cases at the moment stand at 540 known cases, remember. And about 255 of them are in home isolation. So what exactly is happening? How or should we be really perturbed as of this moment on and how to prepare yourself for the holiday season, for the festival season coming in as well? We've got a panel for you. We've got Dr. Subhash joining us. He's member of the National Task Force on COVID, senior advisor at PHFI as well. Thanks so much for your time, Dr. Subhash. And also joining us is Dr. Jalal. He's the president of the IMA. Let me begin with you, Dr. Subhash, on how you're reading the situation at the moment. The understanding I've picked up, at least so far from talking to various doctors, seems to be that a sample collection that is being sent in for genome sequencing still quite low, and that could be one of the reasons why many are saying the numbers that we are seeing on Omicron at the moment is just the tip of the iceberg.
Absolutely right. As a matter of fact, I am not surprised. The more you test, more you carry out sequencing, you are going to get more cases. As far as India is concerned, let us first and foremost appreciate that we are inviting this virus. It has already landed. Number 2, this variant. Number 2, we overall in the Indian context, we are not at all worried, nor we are taking any precautions so that there is no further spread or there is no rapid spread. As a matter of fact, it is so unfortunate that the political parties are, having such massive gatherings and rallies throughout the North India, South India. I mean, what do you expect if we are going to have such kind of a lackluster attitude? And we are also ensuring that in the next few days, when Christmas parties are going to be organized, then the year-end parties are going to be organized. Large number of people are going for various destinations, tourist destinations. With that background...
But Dr. Subhash, can I sort of butt in over there to ask you this? You're a member of the National Task Force, right? Are you flagging these issues to the centre, and what is their response then?
Yes, that is the reason centre is giving this kind of guidelines and directions that please don't do this. As a part of the National Task Force, we have clearly stated that our surveillance system, even for Delta, took long time. As far as the present variant is concerned, sequencing, which is not a very quick process, it's not like RT-PCR or a rapid test that you do it within half an hour or 1 hour or 2 hours. It's going to take longer time. And moreover, such number of centers are also not in large number and their capacity is limited. So with these all background...
No, but when you say capacity is limited, let me bring in Dr. Jalal over there. We've been speaking through the course of the pandemic, the first wave, the second wave, and now, who knows if we're sitting at a time bomb which is going to take us to the third wave as well, about how there is enough capacity. There are enough scientists and labs across the country which can pitch in. And shouldn't this have been a priority, and the big learning that we've had from the second wave? Shouldn't India have sort of expanded the way we're looking at genome sequencing already, now that we're still complaining about it? No lessons learned?
Exactly true. The lesson learned from the second wave is not being implemented today. We know for sure genome sequencing is one of the most important factors to diagnose the variant. But unfortunately, the capacity of us on the genome sequencing is very low, and our protocol for sending for genome sequencing is only 5%. And even the 5%, when the cases are going to be a very high positive rate, It will not be possible for us today to having the genome sequencing lab. It is not possible. The only reason is that there are enough qualified labs, but government is not yet accredited them, like NABL or some accreditation is not given to majority of the labs. Some of the private parties will say that they can go up to 10,000, 20,000 genome sequencing, but the permission is not been given. But this is the right time the government should interfere and put an end to this and put more opportunity for the genome sequencing. We are going to miss out at this moment in spite of repeated commands, requests from the various Senate bodies. If we are not going to proactively work on this situation, India is going to be definitely on an imminent disaster for the third wave at this situation.
Dr. Subhash, we've been talking about this for about 2 weeks now. On NDTV, at least, I can tell you that we've been discussing how it's a ticking bomb, how this is going to happen. It spreads much quickly. Look at the spike protein. Look at how it's different from Delta. I mean, we've been talking about it non-stop. How is it we've again landed up in a situation like this? I mean, forget genome sequencing for a while now. What about stricter norms? Shouldn't they have kicked in? What is the government waiting for? Saying, okay, we are waiting for lab results. Should we, and how should we have really prepared? Should we have kicked in third doses? Should we have started talking about sort of inoculating our kids? See what is happening in Karnataka, for example. People and kids who are below the age of 18 now getting COVID, and now we're wondering how it's going to be.
I agree with what you have stated. As a matter of fact, right now, Government of India has given direction to all the states that ensure that sufficient number of beds which are required in case the situation develops and more patients required to be admitted in ICUs with ventilating facility. So that preparation is already ongoing. Oxygen supply is being assured. So on one hand, the care that need to be done in hospitalized patient, the infrastructure is getting geared up everywhere, whether it's in Maharashtra, Mumbai or any other state, the administration is definitely gearing. But please try and understand that at this juncture, even though you increase the large number of sequencing laboratories, viral sequencing laboratories, what are we going to achieve out of that? See, let us appreciate that as far as viral pandemic is concerned, once sufficient critical number is seen, then you have to consider that eventually it will land into what is called as a community transmission, and transmission is going to get into such an accelerated speed that number.
No, labs are required to know what is the dominant strain in your own country, right?
No, but definitely labs are required.
Not very long ago, we were only sending the samples of people who had a travel history for genome sequencing. How will we even get to know if it has come to community transmission? Yeah,
exactly. Once you have reached that particular level, see, initially when there was a trickle from the foreign travels, now what you are projecting right now on a screen is clear indication that that stage is over. Now it has reached most of the states, most of the metros. That means there is going to be an eventual situation where Omicron is going to be a kind of an community transmission level. That's going to happen. That is what it is, and indications are there. Under the circumstances, as you have rightly stated, Government of India will have to very quickly decide about the third dose. That is the first and foremost thing. At the same time, in spite of the efforts, second dose completion, at least 70% should be our first priority, along with the third dose or the additional dose wherever it is needed.
I agree. Dr. Jailal.
Last point I want to make very quickly.
Yeah.
Last point that I want to make it very quickly, that the ensuring how do we manage these cases. This is what I had spoken in our National Task Force meeting. Do we need to standard treatment protocol that we are following at this juncture? Is there any requirement for any modification? Fortunately, our NDF also clearly stated there is no need. With the existing standard treatment protocol, we will be able to manage if at all there are cases which are going to get admitted. Fortunately, majority are expected to have a milder version. That is what we are expecting right this juncture, and can be managed even with the home treatment. These are the 2 points.
You're saying there is no need of lockdown just yet, is what you're essentially saying.
There is no need of lockdown, but
that's what you're saying.
There is definitely need of restraints. You know, the way people are behaving and the way politicians are behaving. You know, what kind of a message are we giving with lakhs and lakhs of people being invited for the different political functions? This is a dichotomy. On
I'm
one
very
hand you
happy.
say-
I'm very
Yeah.
happy you've brought this up. We don't see it changing anytime soon. However,
Absolutely no.
let me
It is
let me go to
on
Dr.
one hand.
Jayalal. He's been
Yeah.
waiting patiently, and he was shaking his head when you said that we should assume that this will be a milder version and assume that there will be no sort of lives lost. We're talking at a day when the first life has been lost. Any takeaways from that?
Definitely, I will only appeal to National Task Force, other things. Do not just cheat this country by repeatedly saying it is a mild case. And don't say about only the beds and oxygen. What we need at this, when the Honorable Prime Minister on the first day itself, when he immediately convened a meeting and announced the states and the center should take necessary precaution measures to contain this spread. But what steps these bureaucrats are taking? Honorable Prime Minister is repeatedly saying that you avoid revenge traveling, revenge crowd pulling. But what steps government is taking, we want to know. More importantly, don't repeatedly again and again talk about infrastructure. What we need is a manpower. Today, 45,000 first-year PGs are not admitted. They are on the street striking for it. The government so far was 15 days not taking any steps, concrete steps to see to that manpower in the healthcare infrastructure is improved. What you are going to do with just a bed, just an oxygen, just with a ventilator, if there is no manpower in the healthcare?
Right.
Even at background of
Those are very
Omicron,
valid questions. And if you're saying it's going to be wild, by the same study, it also says that it does not require oxygen supply. So the two things don't really add up over here. I have to leave it there for the moment, gentlemen, just to say that there are no simple answers when it comes to COVID. Management is also tough, especially in a country the size, the demographic of like ours. So there are no simple answers here. But at the moment, we don't seem to be catching up with the wave. We only seem to be reacting, which is the really troubling factor at the moment. And we wait to see what more the government has to say on this and how these rules can be implemented, which is the key over here. Thank you both for joining us with your views on that.